During this presentation, we are going to discuss hamstrings and their injuries. To start off, I have some quick hamstring facts. The hamstrings are tendons and muscles located on the back of the thigh. It's important to know where your hamstrings are located in order to really pinpoint if you have a hamstring injury or not. The risk of a hamstring injury can be lowered by stretching regularly. There's no way to 100% protect yourself from pulling or tearing a hamstring, but routine stretching can help prevent the injury. We'll talk about some stretches that you can do easily at home later in the slides. Lastly, there are 3 grades of hamstring injuries, grades 1 through 3, with 3 being the most severe. For different grades, there are different symptoms and treatments, and we will talk about all of those as well. As we have discovered, the hamstring group consists of 3 muscles and their tendons on the back of the thigh. These 3 muscles are the biceps femoris, semitendinosus, and the semimembranosus. The biceps femoris muscle flexes the knee, extends the hip, laterally rotates the leg when the knee is slightly flexed, and it also assists in lateral rotation of the thigh when the hip is extended. The semitendinosus extends the thigh at the hip, flexes the leg at the knee, and internally rotates the knee when the knee is flexed. The semimembranosus provides hip extension, knee flexion, and knee internal rotation of the knee when it is flexed. Obviously, these 3 muscles are very important in both upper and lower leg movement and extension. Knowing the actions of these muscles helps us to understand what kind of movements and activities can cause injury. Explosive activities such as sprinting, running, jumping, or climbing can stretch the hamstrings beyond their limit or stretch them too quickly and cause tears or sprains. Hamstring injuries aren't the most prevalent sports injuries, but they are on up there. They make up 8 to 25% of sports injuries depending on the sport. This injury is seen more in soccer since there's an explosive movement in kicking the ball, stretching the hamstrings at a high speed. This doesn't mean that you can't tear your hamstrings while playing basketball or even while going for a leisure run. If your hamstrings aren't properly stretched and conditioned for those activities, you're putting yourself at risk. Hamstring injuries occur when the hamstring muscles are stretched beyond their limit or stretched too far too quickly. Your hamstrings are only as flexible as you make them. If you don't routinely stretch your hamstring muscles, they will lose flexibility, and a simple serve in soccer could lead to a tear. These injuries most often occur during explosive movements or when the knee is hyperextended in movements such as jumping or sprinting. Recurring injury is very common in athletes because they are constantly overworking those muscles. Being quad dominant, as many football players are, can also lead to recurring injuries because the hamstrings cannot handle the pressure that the force of a lower leg swing causes. There are 3 grades of hamstring injuries. They range from 1 to 3, 1 being the mildest and 3 being the most severe. A grade 1 injury is when there's a mild muscle sprain, but there's no actual tear of the muscle. Grade 2 is when the muscle or tendon is partially torn, and grade 3 is when there's a complete tear of the muscle or tendon. Because each grade has a different severity, there are different symptoms and treatment for each. For a grade 1 injury, symptoms may include sudden pain and tenderness at the back of your thigh upon injury. It may be painful but not impossible to move your leg, and it will be especially painful to try and extend your leg at the knee. However, the strength of the muscles should not change, so within a few days you should be good to go. A grade 2 injury is a little bit more moderate in severity. With a partial hamstring tear, you may experience more pain than you would in a strain, and there may be swelling and/or bruising at the back of the thigh. You may also lose some strength in whichever leg is affected. A grade 3 injury is the most severe of all 3 grades. It is very painful, tender to touch, swollen, and bruised. At the time of injury, you will feel a distinct popping sensation indicating that the hamstring has completely torn away from your bone. You will also likely be unable to use the affected leg at all. This slide here kind of shows you what it looks like, what each grade looks like. So you have your normal hamstring with no tears, no sprains. Your grade 1 sprain has small tears and stretching in the hamstring, but it's still intact. A grade 2 sprain is partially torn, but it doesn't go all the way through. And a grade 3 sprain is a complete tear in your hamstring. The image on the right shows a grade 3 injury, and as you can see, it's very swollen and bruised where the hamstrings are located on the back of the thigh. If you suspect you have injured your hamstring, you should see your doctor. The doctor will check the back of your thigh for points of sensitivity and swelling, and the location and intensity of your pain can help determine the severity of the tear. The doctor may also move your injured leg into a variety of positions to really help determine which muscle of the hamstring group has been torn. In a grade 3 injury, there is a possibility that a small piece of bone can be pulled away with the tendon, and this is called an avulsion injury. If this is suspected, your doctor will perform an X-ray to confirm. And in this figure 6 on the slide, it's showing the fragment of bone that has been pulled away with the tendon. The baseline treatment for all 3 grades of a hamstring injury is the RICE method: rest, ice, compression, and elevation. The severity of your injury will determine how long you should do the RICE treatment and whether or not you need rehabilitation. You should avoid any physical activity, apply ice packs for up to 20 minutes each day, every 2 to 3 hours, but don't apply ice directly to your skin. Always make sure that you have a pillowcase or a towel or some type of cloth between your ice pack and your skin. Compressing your thigh will help control the swelling and limit your movement. You can use a simple elastic bandage, or your doctor may provide you with a compress after your visit. Keeping your legs slightly raised above your heart and supported on a pillow will also help to reduce swelling. It's also advised that you take a pain medication. That can be over-the-counter ibuprofen, or your doctor may prescribe pain medication if your injury is severe enough. And you don't have to take pain medication, it's completely up to you. In a grade 1 injury, you're probably not going to need it, so that more applies to grades 2 and 3. Also likely that your doctor will prescribe physical therapy to help re-strengthen your hamstrings and get back your full range of motion once healing has started. Physical therapy would be needed in a grade 3 injury, but definitely not a grade 1, and for a grade 2, it would really just depend on how badly your strength was affected in that leg. Recovery time is dependent on the severity of the injury. A grade 1 tear will only take a few days to heal with just rest and avoiding physical activity. And grades 2 and 3 could take weeks to months with the RICE method and physical therapy treatment. During the time of your recovery for any of the grades, you'll be unable to resume training or sports until you're cleared by your doctor. Even if you're feeling a little bit better, it's very important to make sure that you have that clearance because something could be going on that you don't realize. How to prevent hamstring injuries. Preventing hamstring injuries is simple but also not guaranteed. There's no way to 100% protect yourself against any injury. However, stretching is the best way to lower your risk. Because hamstring tightness is the single most important factor in recurring hamstring injuries, stretching regularly and warming up before exercise can reduce the risk of injury. There are many simple hamstring stretches you can perform at home. The simplest is shown here in the left image. You sit down on the floor with your legs extended and you slowly bend forward at your waist as far as possible, but you want to keep your legs straight. You should be able to feel the stretch in the back of your thigh on your hamstrings, but you need to stop bending if it becomes painful. The stretch on the right side of the slide is called the hurdler stretch, and it's very similar to a simple hamstring stretch, but you're going to fold one foot in and keep your neck and back as straight as possible as you lean forward with your palms flat down and your arms straight. So you will hold this stretch for about 30 seconds on each side, and the more you stretch, the longer you'll be able to hold that stretch and the further you'll be able to lean forward. I found these stretches and so many more at the link below, and I attached it so that you all could visit the site, but since this is a screen recording, that can't happen. But if you do a quick Google search for hamstring stretches, you'll get a ton of results. And doing even the bare minimum of stretching is better than none at all, and the more you stretch, the easier it will become. So I hope you all now have a better understanding of hamstring injuries and how to prevent them, and just how important it is to stretch and how simple it is to stretch.